demonstrating how to do how to obtain a blood sample from central venous access. So we reviewed our patient's chart. So our patient has subclavian central venous access. And then I'll do hand hygiene and gather my supplies. So I already prepared my heparin refilled syringe. So I've already checked the facility's policy regarding the heparin locking, as well as my physician's order for heparin locking. So for a subclavian line, we are going to be locking it with 200 units of heparin, and the concentration for this one is 100 units per ml, and I have 2 mLs in the syringe. I already got rid of the excess and also, in the clinical setting, this would come in a package and the tip would be sterile, but since we reuse this for practice in the lab setting, they're no longer in the package. We'll also need 2 post flashes. These are 10 cc normal saline prefilled syringe. Same thing with the heparin. This would be this would come in a package in the clinical setting. And then I have my 10 ml empty syringe to aspirate the heparin that's currently in the lock. I have my blood tube, so our order is for CBC, so we have lavender tube. We have our vacutainer, clean gloves, and alcohol swabs. So I'll do hand hygiene and enter my patient's room, introduce myself to the patient, make sure I have the right patient, and explain the procedure. So hi, my name is Alex Cruz. I'm a year 3 student nurse at the University of Manitoba. I'm here to obtain a blood sample from your central line. Is that okay with you? Our patient agrees. And can you please tell me your name and date of birth? Mandy Myers. So I'm checking the armband, the requisition, as well as the blood tube labels for our patient's name and another patient identifier such as the FIN number to make sure we have the right patient. So Mandy Myers, and then FIN number is 123 456 789. So everything matches on all 3, so we have the right patient. And then if there is an infusion that's currently going in, which our patient has, we would stop the infusion and put the pump on standby. That way we can ensure that our blood sample will not be contaminated with the infusion that's going in. So the machine is now on standby. I have put it on standby in my previous attempt and I forgot to restart it again. In the real life, I would stop the infusion, put the machine on standby, and then wait for 2 to 5 minutes before I obtain my blood sample. Again, that way it won't be contaminated. Our blood sample will not be contaminated. And then I'll do hand hygiene. Let's pretend that the 5 minutes have passed. I would put on my clean gloves. And I would, using an alcohol swab, we are going to use the brown lumen because the brown lumen is often the largest. So I would use the brown lumen to obtain my blood samples. So I will swab it for 30 and let it dry for 15 seconds. And then using an empty 10 ml syringe, we are gonna banana peel it. And so this is a sterile syringe. We will aspirate the heparin that's currently in the lock. We want to aspirate at least 6 cc's. That's a mix of heparin and our patient's blood. We will discard this later. And then we want to connect our vacutainer onto the lumen. So banana peel it and then connect those 2 together. And also we want to make sure, I would do this in the beginning of before I even access the CVL. I would make sure that all of the clamps are closed. So all of the clamps are closed right now. And then I would connect my blood tube onto my vacutainer and then unclamp my line. And then in real life, the blood tube would automatically fill itself with the amount of blood that it needs. However, our mannequin doesn't have a blood pressure. That's why it's not filling, but in real life it would. I would clamp my line and remove my blood tube. And then as per the inversion guide, we need to invert it 5 to 10 times. So that's 1, 2, 3, 4, 5. And then we'll set that aside for now. We will remove our vacutainer, and then we will flush with our normal saline. So we would get rid of the air bubble first. And then we'll connect that. And then instill. Oh, it's can't. That's why I'm meeting resistance. So we would instill using the push pause method. I would clamp and then remove, and then flush again with another one. Get rid of the air bubble. And then unclamp, and then instill the normal saline using push pause method. I will clamp my line again and remove this. And then for locking, we will use our heparin. And then we would instill the 1.5 cc normally, and then at the last 0.5 cc, we would create a positive pressure in the central line by clamping the line and instilling the last 0.5 cc of heparin at the same time. So that's good. So we will remove this, and then we will restart our infusion. So primary, start, confirm primary, start, make sure that the clamp is unlocked, and then I would do hand hygiene, and then I would label my blood tube, and then send that to the lab along with my requisition. And I would I would sign my MAR for the heparin lock, as well as fill in the CVAD flow sheet.